President. I'd like to ask the Minister for Health and Social Care, in the light of the reorganisation of the Ramsey and District Cottage Hospital, what plans she has for the future of the minor injury unit and the medical support for the nurse-led service there.
Minister to reply.
Thank you, Mr. President. There are currently no changes planned for the minor injuries unit at Ramsey and District Cottage Hospital. The hours of opening will remain as at present, which are 8 a.m. to 8 p.m, 7 days a week, 365 days a year. Activity in the unit will be monitored, as with all of our hospital services. It is hoped that in time, the number of patients seen each day in the minor injury unit at Ramsey and District Cottage Hospital will increase from the current average of 24 patients. The unit is currently staffed by experienced advanced nurse practitioners, and these staffing arrangements will be maintained. Additional clinical support to the minor injuries unit will be provided by the middle grade doctor, who will be employed as part of the reorganisation referred to by the Honourable Member. In addition to this, medical support will also be available from those Nobles Hospital-based doctors who are delivering outpatient clinics at Ramsey. Telephone advice and guidance will also be available from the clinical team in Nobles Hospital Emergency Department. In the event of a difficult or emergency clinical situation, the patient will be transferred by ambulance from the minor injuries unit to the emergency department at Nobles Hospital, as is the case now.
Supplementary, Dr. Allinson.
Thank you, Mr. President. I'd like to thank the Minister for that reaffirmation. The minor injuries unit at Ramsey, although it's minor injuries, sometimes does deal with major trauma, particularly when the north of the island is cut off during the TT and Festival of Motorcycling. And also there's been considerable investment in that area. Would she also look into perhaps the role of telemedicine in terms of increasing the links with the A&E department in Nobles so that people can get the right treatment at the right place in the north?
Minister.
Yes, thank you, Mr. President. I think I said in my original response that there would be links with the emergency department, and there'll be advice on hand whenever it's needed at minor injuries unit. As I'm hoping that with the broadcast of all this information, that people will actually realise that the minor injuries unit is available to everybody on the Isle of Man. Some people, including myself up until sort of fairly recently, thought it was just for the north. And sometimes the waiting lists at the minor injuries unit in Ramsey are considerably less than those in Douglas. So it's worth bearing in mind, and we hope that that footfall in Ramsey will increase in the future.
Honourable Member for Ramsey, Mr. Hooper.
Thank you, Mr. President. I'd like to thank the Minister for confirming that the nurse-led service and the MIU are going to continue in their current form. She mentioned there the level of experience the staff have up at Ramsey, and I just want some clarification really on, will the department be working with the staff and with the GPs who've been providing the service for quite some time to help develop the new service, the new medical support, to make sure it is adequate and appropriate, and to make sure that all that experience that they have isn't lost?
Minister.
Thank you, Mr. President. I can absolutely give that assurance. We will be working with everybody, and I say it will be a consultant-led service in the north. So we'll have a consultant, we'll have a speciality doctor, and we'll have all the very ably trained people that we have now. So it is going to improve the service massively to the north of the island.